Croesawu pawb I digwyddiad eno. Welcome everyone to tonight's event. Now, before we begin, I just want to provide a brief technical introduction. We're using Microsoft Teams today, and Microsoft Teams allows you the opportunity to see live subtitles of this evening's proceedings. You should see a button in your settings to switch those subtitles on. And subtitles for today's meeting are available in Cymraeg and English, as well as Arabic, Polish, Chinese, Ukrainian and Urdu. Now, Teams also allows you the opportunity to share your feedback as well. On your screen, you should see a tab with a question mark on it, and this will normally be in the top right of your screen. If you click on it, it gives you the opportunity to share your feedback with our presenter panel here tonight. So please accept our apologies that we might not be able to answer all of the issues raised during today's event, but we will continue to update our engagement website with all the latest information. You'll see on that site it's got a detailed Q&A and an equality impact and other materials about the process that we're currently undertaking. And today's event is also being recorded. Now, don't worry, it doesn't share information about you in the audience, just the information that you see broadcast on the screen tonight will be visible. So this does mean that people who can't join us live this evening will still be able to watch today's briefing at a later date. So thank you very much for joining, and our briefing will now begin.
Diolch yn fawr, Adrian, Nos dda pawb, good evening everybody. Thank you for joining us this evening. My name is Kirsty Williams and I'm the Vice Chair of Powys Teaching Health Board. I also have an important role to play in this process. Following the application from the Crickhowell branch surgery to close Belmont branch surgery in Gilwern, Powys Teaching Health Board has invoked its policy that deals with branch practice closure requests. That means that I will chair a review panel that will gather together the information from events such as these and our wider engagement, and then we'll consider those representations, and then we'll make a presentation to Powys Teaching Health Board in regards to the outcome of the application that we have received. So it's really important to be here in person to hear your views, so that I can report them back to that review panel. Also joining us this evening are a number of colleagues, which I will now invite to introduce themselves. Firstly, colleagues from the Crickhowell Group Practice who have joined us this evening.
Hello, good evening. My name is Dr. Apu Poddar. I'm a GP at the practice and I've been a partner there for nearly 28 years. I'd like to thank the panel and the participants for giving us the opportunity to listen to your views and air your concerns. Joining me from the practice are Dr. Paul Barnes, Dr. Rachel Davis and Mrs. Julie Chewin, our practice manager.
Thank you, Dr. Poddar, for that. Powys Teaching Health Board are working closely during this process with colleagues in our neighbouring health board who are also joining us this evening.
Good evening, everyone. My name is Will Beer. I'm the Interim Divisional Director for Primary Care and Community Services in Aneurin Bevan Health Board, and I'm here with Vicky Taylor, who's the Head of Primary Care Services for Aneurin Bevan.
Thank you very much, Will, for joining us. As you can imagine, we are joined by a number of colleagues from Powys Teaching Health Board this evening, who will now introduce themselves. Over to you, Kate.
Okay. Good evening, everybody. I'm Kate Wright and I'm the Medical Director in Powys.
Good evening, everyone. My name is Amanda Walters and I'm Head of Primary Care Development and Support for Powys Teaching Health Board.
Thank you both. There are a number of colleagues from the Health Board who are supporting us this evening in a technical role, so you might be aware of that. But can I now introduce to you to make a presentation on the substance of the matter before us this evening, Can I hand over now to Hayley Thomas? Hayley is the Deputy Chief Executive of Powys Teaching Health Board and the Director of Primary Care. Over to you, Hayley.
Thank you, Kirsty. Noswaith dda pawb. So yes, as Kirsty's just mentioned, the Health Board received an application from Crickhowell Group Practice to close their branch surgery premises at Belmont Surgery in Gilwern. And if agreed, this would mean that patients will then access services at the War Memorial Health Centre site in Crickhowell. As part of the process, the Health Board is working closely with Powys Community Health Council and the Dyfed Powys Local Medical Committee. As this branch surgery is also located in Monmouthshire, we're working very closely with our colleagues who have just introduced themselves in Aneurin Bevan University Health Board, and also our Powys Community Health Council and ourselves are working very closely with the Aneurin Bevan Community Health Council. As part of this process, we need to hear the views of the patients affected by this proposed change and who are currently using the branch surgery. And the period of engagement is really important to understand more fully what the use of the branch surgery in Gilwern has been, both in terms of the whole team, the GP, the nurses, healthcare assistants, and also how this proposal would affect you, including any issues you would have in attending the main surgery in Crickhowell. Wherever possible, we would encourage you to respond online, as this will reduce our carbon footprint, but also it makes it very easy for us to be able to analyse the information that comes through. However, we don't want this to be a barrier, so if this isn't an option for you, then you can contact us and request a printed copy. And we'd be very grateful if you could return your completed questionnaires to us in the Health Board by the 6th of March. You can access the questionnaire online at www.pthb.nhs.wales/Gilwern or by using this QR code. And to use this, all you need to do is open your mobile phone camera, aim your camera at the QR code, but you may need to select Open in Browser to access the website. If your camera doesn't scan the QR code, then QR scanners are available to download in the App or Play stores, or you can type the address above into the internet browser on your phone, tablet or computer. If you have any issues accessing the online questionnaire, please ask a friend or relative to help you to access the website. But if you're not able to access the online questionnaire, you're very welcome to request a paper version to be sent to your home. And in this case, if you would like to please contact our primary care team on 01597 828805, or you could email primarycaregeneral.powys@wales.nhs.uk. This information is also available in different formats on our website, and also our website provides further information about the application, including some frequently asked questions. Just want to reassure you that you do not need to give your name or address for the questionnaire, although we would appreciate if you could state your postcode, because that will really help us to understand how this proposal affects different parts of the community. Alternatively, you can also contact your Community Health Council. The contact details for Powys Community Health Council are presented here, and the telephone number is 01874 624 206. Or if you would prefer to contact Aneurin Bevan Community Health Council, their telephone number is 01633 838 516. And both community health councils will be working with us closely throughout this process. And as I said earlier, more information, including the application, frequently asked questions, is available from our website at www.pthb.nhs.wales/Gilwern. Some important dates for you to consider is that we started this engagement process on the 10th of January and it will end on the 6th of March. So it will be really important for you to get your views and get your completed questionnaires back to us by the 6th of March. And then during March, we will be taking forward a review of the feedback from patients, working again with the community health councils and also with the Neirin Bevan University Health Board. Our plan is to make sure that we are considered this information and that we meet then as a health board in April, at the end of April, in public, so that the details of that meeting will be shared on our website, and that at that meeting we will be making a decision on the application from Crickhowell Group Practice. And subject to the decision being taken at the end of April, we will be ensuring that all patients will receive a letter confirming the decision and next steps during May. So I'd like to hand over now to Adrian Hawthorne, our Assistant Director of Communications and Engagement, who will take us through some of the insights and what we've already heard from the local community and stakeholders around the application. Thank you.
Thank you so much, Hayley, for that helpful overview of the process. In terms of the next steps, I'm wondering if we can next have slide 8 on screen. That would be really, really helpful. Through this process, we've already written to each household where there's registered patients living across the South Powys and North Monmouthshire area. And thankfully, hundreds of people have already been responding to our online questionnaire and sharing their feedback in other ways. And if you haven't already had the opportunity, there's lots of useful information on our engagement website. So on there's a frequently asked questions document. You can also find our draft equality impact assessment. And what that does is provide more technical data about the proposal, including where patients are currently registered, which community council areas they live in, how many patients are registered with the practice. And one of the key purposes of that document is to help us understand how this proposal might impact on different parts of the community, for instance, relating to equality protected characteristics. And through that, we can develop plans for mitigating impacts that this proposal may have. And that's if the application is accepted by the Health Board at the end of this process. In terms of the next slide, then, please. Both tonight and prior to this evening, there's some pretty frequent questions that have been coming up. And as these questions arise, we've been updating our frequently asked questions document in order to make sure we're answering the main questions that have been raised with us. And I guess the most common one is, well, why has Crickhowell Group Practice asked to close Gilwern branch surgery? Now, it's fair to say that in their application, they've set out that they face a twin challenge here. The GP practice partners who own the Belmont surgery premises are retiring. Some have already and some will retire soon. And at the moment, no feasible or affordable options have been identified for the remaining practice team to take over that building. And then alongside this, you may be aware from the media that there are wider pressures facing general practice in terms of demand and recruitment that make it very difficult to maintain services at the branch surgery without reductions in the overall range of services that the practice is able to offer. So the practice does consider that that current position is unsustainable, and if not addressed, it could lead to the loss of further services in the area in the future. So as a result, they've submitted an application to the Health Board to close the premises in Gilwern at Belmont Branch Surgery and consolidate their services at their premises in Crickhowell at the War Memorial Health Centre. So that's definitely been one of the big questions that's been raised so far during the engagement. I think next, on the next slide, is what alternatives to closure have been considered. So it's important to stress that even before going out to engagement, we have been considering alternative options. Unfortunately, those have not been successful, but we do continue to keep these under ongoing review. So ideas that people have suggested are, well, could an alternative organisation purchase the Belmont Branch Surgery in Gilwern for continued use by the practice? And no alternative organisation has been identified at this stage. And as we said, Crickhowell Group Practice has identified within its application that it will be increasingly difficult to maintain services from across 2 premises, given ongoing workforce challenges. A second idea put forward is whether Belmont Branch Surgery could be purchased by a different GP practice who take over responsibility for the patients or the premises with continued delivery of primary care services. And again, as you might anticipate, we have sought expressions of interest, but again, so far no alternative primary care organisation has said that they would wish to take on those premises. A third suggestion that's been put forward is, could Belmont Branch Surgery be purchased by an alternative organisation, not a GP practice, for the continued delivery of health or other services? And now that obviously remains an option if the premises did become available to purchase on the open market, for instance, for purchase by a local community group. But neither Powys Teaching Health Board nor an Bevan University Health Board at the moment has identified that the purchase of that premises would be a feasible or affordable option for us, aligned with our overall estates strategy. But again, clearly this is part of the engagement process, is to keep all of these options under review, and they will form part of the recommendation that's made to a meeting in public of the Health Board following this engagement period. A further question that people are asking is, well, what sort of criteria do we use to make decisions like this? And it's very, very important to stress that as health boards, as health bodies who are given the undoubted privilege of responsibility for local health and healthcare services, we don't take decisions like this lightly. And so we've identified 4 key criteria that will be used to judge on this application and make decisions on the way forward. The first one, importantly, is about safety and quality. So will it help to ensure that GP primary care services are safe and clinically effective? The second key criterion is sustainability. So will it help to ensure that GP primary care services are sustainable for the medium to long term? A third key area is workforce and deliverability. So will it help us with recruitment and retention? And is this option feasible, and can it actually be delivered? And then the fourth key criterion, and clearly a lot of issues have been raised already in relation to this during the period of engagement so far, is access. So what impact does it have on access and experience for the communities we serve within the Crickhowell Group Practice and beyond? So those are the sorts of issues that will form the decision making after the end of this engagement period. We've also been asked some very specific questions about the impact on patients. So will patients who live in the Gilwern area be able to remain registered with Crickhowell Group Practice? And the answer is yes. All patients registered with a Crickhowell Group Practice can remain as a result of this application. Would the practice continue to provide home visits in the Gilwern area? And yes, the practice would continue to offer home visits when appropriate for patients across all of their catchment, as there isn't a plan to change the catchment area. People have also asked, well, could they choose to register with a different GP practice as the result of this proposal? Now, I'm sure that Crickhowell Group Practice would want to be able to continue to provide services for their current registered patients. But yes, if your address is located within another GP practice area, you can contact the practice of your choice directly and request to register with them, and they would be able to support you through the new registration process. And we've also been asked questions just to clarify sort of how many patients are registered and where do they live. And so within the frequently asked questions and the equality impact assessment, you will find some useful information about this, including maps and the numbers of patients living in different areas. So the map on your screen now is available in the equality impact assessment, showing the distribution of patients from up towards Talgarth in the north through down to Llanelli Hill, Llanelworth, Gafaelon, and the outskirts of Abergavenny in the south. And also there's numbers there to indicate how many patients live within each community council area as well. Now I should stress that these are the county council, the electoral divisions area, rather than the community council areas, and these do actually reflect the electoral divisions prior to the last election, as that's how this data is currently available, but it still gives you a good indication of that distribution. So 2,949 patients from Crickhowell, 2,739 from Llanelli Hill, 1,007 from Llangunada, 959 from Llangattock, and 798 from Bulch are the largest of those wards, and you can see on your screen there and in the document the list of the other ward areas that the registered patients come from and the distribution of them. So I think those are some of the main questions that have arisen so far, and as I mentioned earlier, those questions and others are answered within the frequently asked questions on our website, or for people who do not have access to the web, then there's the opportunity to contact us to have a printed copy sent to you. We also have a drop-in event taking place in the Gilwern Community Hub on the 14th of February, and we'll have printed copies of materials available there as well for people who aren't able to access those online. And also online as well, we've got alternative versions of our materials such as British Sign Language and audio versions and Easy Read as well, to help provide access to this information through a variety of means. Now, I mentioned earlier that this engagement period has been ongoing, and already several hundred people have responded either through the online portal or by writing to us, and we have a series of routes there by which people can respond, and so I'd just like to go through some of those themes that we've already heard in those responses so far. So firstly, people have shared their views about the impact on the practice and registration. So here are some quotes that we've heard. I'm concerned that with the retirement of several doctors, the burden on the remaining medics of keeping Gilwern surgery open will be too great in both financial and workload terms, and that this will lead to an overall deterioration in the good service that they currently provide. People have also said they need to recruit more doctors and nurses, and clearly that's part of the challenge of the reason why the practice has submitted this application. Better to have all specialised practitioners working in one place. By having one surgery, there is less admin time, enabling an ongoing effective service. There have been less appointments available at Gilwern recently, including affected by COVID. I have needed to go to Crickhowell more often, and there are fewer appointments available, like health visitors, district nurses and midwifery at the branch. I think that's a good opportunity for me to stress that in the questionnaire, we do ask about the number of appointments that you've had within the recent 2 years, but importantly there, we also ask you to tell us whether that has changed compared to pre-COVID period as well, because importantly here, we recognise that COVID has had an impact on access to all health services, including to general practice. So within that question on the questionnaire and also the space that you have for providing additional comments, we very much welcome those reflections about how experience had changed prior to COVID and leading up to COVID as well. Another comment here as well is that the practice boundary has already changed so that people from Clydach cannot register. Will it change again to exclude Gilwern? So asking about potential future changes to the practice boundary, and at the moment there are no plans to further change that practice boundary, and as mentioned earlier, the patients living within the Gilwern area will be able to remain registered with Crickhowell Group Practice. Also asking, will this cause more pressure at Crickhowell and make it more difficult to get an appointment? And people have said it may be that a newly qualified doctor would be interested, especially with Neville Hall nearby, hospital nearby. And also if the plan is to close the Gilwern surgery, my wife and I will probably join the many others that have or are planning to switch to a practice in Abergavenny. And as stressed there in conversations with Aneurin Bevan University Health Board have confirmed that there are neighbouring practices with open lists. Again, Crickhowell Group Practice would like to continue to offer a service to people, but recognising the impact of the branch practice closure. But yes, there are neighbouring practices that have open lists that could take on additional patients. We've also heard a number of questions and issues linked to the potential impact on the local population and services. I think it's clear that where there is a GP practice within the area, people see that as part of their civic and community identity and the local service offering. So people have said the population is increasing and getting older, but the services in the area are decreasing. They've said this will have the greatest impact on people who already have access difficulties, such as people with disabilities or the elderly. It's frustrating that we've lost services from Neville Hall and now there is a plan to close the surgery. Will this affect the pharmacy in the village? This used to be a branch surgery for Bryn Mawr. They closed and Crickhowell moved from their previous premises, so I've transferred to them and now they plan to close too. We've lost a lot of services from Gilwern in the last 30 years. The surgery was one of the reasons I moved to Gilwern, and closing the surgery will mean that fewer people will want to move here, which will have a bigger impact. It's frustrating living in a rural area that local health services such as these are disappearing and departments at Neville Hall being moved to the Grange. And the Aneurin Bevan University Health Board Community Midwife Clinic is now held at Neville Hall as the surgery has closed. Having to catch a bus to the hospital for fortnightly appointments with my midwife is a huge inconvenience. So very much these are the kind of issues that we are hearing and that will be a really important part of the consideration process. And I think I should stress as well that where you're raising these issues and themes, please provide us with kind of more information and useful background that helps us understand that impact, and also things that might be done in order to mitigate any impact as well. So a further theme as well is that people have suggested alternatives to closing the branch, and some of those I mentioned earlier. Could another GP practice take over the premises, such as one in Abergavenny? Could Crickhowell close the Crickhowell premises and keep Gilwern? Could the health board buy the premises and offer the space to any local practice and community services, a bit like a bank hub being open to use for a wide variety of services? And could the community buy the premises so that the GP and nurses can keep coming? So again, if you've got those kind of suggestions, let us know as part of this engagement. There's space in that online questionnaire, or you can write to us with your submissions as well. And again, any information that you can provide that helps provide further background to help us explore those in more detail would be very, very gratefully received. And last but not least, I think it would be fair to say that by far the biggest theme that people are raising is around travel and transport. So again, here are some examples of the feedback. Some people do not have a car, they will need a lift to Crickhowell. There is not a direct bus route or community transport, and it can be difficult and expensive to get a taxi. It can be difficult to park at War Memorial Health Centre, particularly with a child's buggy. I can walk to Belmont surgery, which reduces my carbon footprint. I won't be able to walk to Crickhowell. Transport will be more difficult in a cost of living crisis. The road to Crickhowell can be closed due to flooding. Other practices would now be closer for me and with better public transport links. Gilwern is a shorter journey when I am feeling unwell. But also we've heard from people living further north from Crickhowell as well. So Crickhowell serves a very large rural area to the north who already have a very long way to travel. If one site has to close, then Crickhowell should stay open as it's the better option to cover the whole catchment. And living in Talabont, it's 9 miles to Crickhowell practice or 9 miles to Brecon. So that gives very much a flavour of all of those issues that we're hearing and acknowledging, and that will form part of that process of conscientious consideration going forward. And at that point, I'd like to pass back to Hayley Thomas for any reflections that you would like to share on those themes and issues.
Thank you, Adrian. An awful lot in that presentation, and just gives a sense of the issues that people are raising, and we will, some reassurance really. I'm not going to be able to respond to all of the points within the presentation, and it'll be really important for us to give it due consideration and to include all of the insights that you've just shared within our engagement report, so that the board is fully appraised of the issues and concerns of the local community. But just a couple of reflections really. I think that the wish that the public have raised around the ability to recruit additional staff, clinical staff into the area, is a wish that we have in the health board as well. And you know, working both locally and nationally on things like the Train, Work, Live campaign, it is really important that we do our very best to try and recruit GPs but other clinicians to come and work within Powys, but clearly there's the national challenges around recruitment is causing concern for us and many other areas across Wales as well. The concerns that some of the themes that were raised around how the practice would manage within Crickhowell if they were to close the branch surgery is a theme that I pick up around, particularly appointment availability and some of the pressures, the space pressures, and how the team would be managing within the practice in that scenario. And again, as part of the application, that will be one of the key issues that we'll be looking at in both the branch review panel meeting, but also in taking it forward to the board. There was a mention a lot about practice boundary, and I'm really pleased to be able to confirm that the practice do not intend to change their practice boundary, and obviously would like to see the patients continuing to be a member of the practice. But clearly there are choices there that some members of the public may want to change, and that is down to patient choice. And I think that the other issue for me is around particularly the impact. It was mentioned around pharmacy, and we know currently all the repeat prescriptions for Gilwern patients are generated in the main sort of War Memorial Health Centre site in Crickhowell, and then is collected by the pharmacist for dispensing and collection at the Gilwern pharmacy. So again, there's no proposed change to that service. And I guess just a final reflection from my perspective is around the travel and transport concerns, and the position that it's not on a public bus route between Gilwern and Crickhowell, and also there is no community transport, and clearly that will be part of what we have to consider as a board, that the concerns around transport, travel and access, we know that there will be a greater impact for people who don't have access to a car. So again, we'll be considering that as part of the application. So those are just my initial reflections, Adrian, and I'm very happy, Chair, to take on any other questions as we proceed with the session.
Thank you very much, Hayley. So what I'm going to do now is look through some of the questions that we've had either posed in advance or in the Q&A panel. So what we've been asked is, I did cover this briefly in the presentation, but it's about whether neighbouring practices have open lists so that if people did choose to move to an alternative practice, potentially, for example, one where they could use public transport, are those lists open? And the reassurance from Anara and Bevan University Health Board is yes, there are neighbouring practices there that are open for patients who are resident within the practice boundary, and patients do have that choice to register with an alternative practice if they wish to do so. I think it's important to stress here that a decision about the future clearly has not been made yet and can only be made following this engagement period, and once the issues and views that we've heard are considered through the Health Board's branch practice review panel and then taken to a meeting in public of the board. But whatever the outcome of that, as I said, there'll then be the plan to write to patients about the next steps. So, for example, if the decision was made to accept the application, then that letter would include information about those alternative practices and how to register for people who did have an interest as well. I think a second question that's got raised in the chat panel as well, which I also touched on briefly in the presentation, was yes, it's true that in the questionnaire we do ask about the number of appointments that people have had during the last 12 months in order to capture their most recent experience. But we do then also ask that question, how does this compare with pre-COVID? And then if there are particular issues that you want to share about how services changed pre and post COVID, use the additional space in that questionnaire in order to do so, because this isn't about making a decision purely on the basis of the services that have been available since the start of the COVID pandemic. We need to look at in the entirety of how this affects people's experience of using the practice now and into the future. So again, thanks for raising those questions so far. People have asked us what happens next in terms of these next steps on the engagement process. So within the presentation, we included some of the headlines there, but basically following this engagement, the Health Board will be analysing the feedback that we've heard and producing a report on that. And it's really important to stress as well that the Community Health Council, both in Powys and in Anara and Bevan, have a really critical role in that, because we will be sharing the feedback that you've shared with us with those community health councils so that they can make their own observations and contribute to that process of review. So for those who aren't aware, the community health councils are statutory bodies to represent the public interest in health services. Also, you may be aware that during this time frame as well, the current community health councils are due to be replaced by a new citizen voice body called Voice, and that new body will come into effect from the 1st of April. So potentially that will be taking place while we're going through that analysis page and before a recommendation is made to a meeting of the Health Board. And our reassurance is that we're continuing to work with the CHCs through that transition to the new citizen voice body to make sure that the patient voice remains fully part of this process. And there's more information about the role of the community health councils and how you can contact them within the FAQs on the website and within the letter that we've sent to patients as well. Another question that we've been posed is, well, how many appointments take place at Belmont Surgery and at War Memorial Health Centre? Well, that information is included in the Equality Impact Assessment as well. So if you're keen at looking at the details, including the frequency and availability of clinic sessions, we've included that detail for you to be able to find out more and help that inform your own response to this engagement and consultation. And I would stress as well, if you've already completed that questionnaire with your views about this engagement, but new thoughts arise, please do come back to us, because this has to be an ongoing debate. We very, very much recognise the impact that applications like this has on patients and on communities. And so it's of vital importance to us that you take this opportunity to share with us information that you feel is material and relevant to the decision that we need to make. So if more ideas come to you, then please pop back into that questionnaire again and share those with us so that we can continue to explore all options available to us. People have asked, will it be more difficult to get an appointment? Will it put more pressure on the surgery in Crickhowell? And again, these types of issues are really vital to us during this engagement. In relation to the application that we've received, I think the concern is that if there isn't a change, if the branch surgery doesn't close, then that will actually make it more difficult. And this would allow the practice to stabilise their service, again, particularly recognising the wider challenges in recruiting and retaining GPs that are affecting the wider NHS at the moment. And just checking for other questions that are coming through. So yes, the emphasis is again, another question coming through. It's like, well, I really want to stay with Crickhowell Group Practice. They've been my practice for many, many years. The travel distance will make this more difficult for me. Will the health board be able to look at steps that might improve travel and transport between Gilwern and Crickhowell? So again, thank you for that really, really helpful feedback. And if you do have particular thoughts or ideas about how that could be done and how we could work with local communities in order to address some of the travel and transport issues that you have raised, then we're really, really keen to hear your views as part of this process and as we move forward to the next steps. Next, I've got quite a technical question, which is actually, why is it Powys Teaching Health Board that's leading this process rather than Anar and Bevan, where the Gilwern branch surgery is located? Well, each general practice has a main base, and therefore through that main base has its contract with a local health board. So for Crickhowell Group Practice, that contract is with us, Powys Teaching Health Board, and that contract covers its premises in War Memorial Health Centre in Crickhowell and also the Belmont branch surgery in Gilwern. And as a result of that, it's to us they need to submit the application, and we have the contractual and statutory obligation to consider that application and make a decision on the next steps. But our reinforcement there is on this call today. You've had colleagues from Crickhowell Group Practice themselves, also from Anar and Bevan University Health Board, who we are working closely in partnership with, and then also with the two community health councils, because clearly we recognise that this is a cross-border practice and cross-border community, and so it's vital for all relevant partners to be part of the process to consider this application. Now, I'm just checking whether we've got any more comments and questions coming through here, but I think and I hope that the main issues that have been raised through your comments in the Q&A panel I've sought to address, and we will of course continue to keep updating the frequently asked questions and our website with the very, very latest information. So thank you for that. And at that point, I would like to hand back to our Vice Chair, Kirsty Williams, for some reflections and closing remarks. Thank you very much.
And thank you very much, Adrian, for taking us through that presentation on the feedback that we've received to date as a result of the engagement exercise and answering questions that have arisen this evening. Before we draw this evening's meeting to a close, I'm going to go back around for colleagues to make any closing remarks or reflect on what they've heard this evening. So Dr. Podder, I'll come to you first before going to colleagues at Bevan. Dr. Podder.
Oh, you're on mute there, if that's okay. I'll just try and unmute you.
Sorry. Thank you, Kirsty. It's been a very difficult decision to make to consider the closure of Belmont surgery. And I can assure you that we, as a practice, have thought long and hard about this. I'd like to express our commitment to continue to provide healthcare and to listen to the views of all our patients. I recognise this process, will raise lots of concerns and questions for some people, but I hope this event has gone some way to answering some of these concerns.
Thank you very much, Dr. Podder, for that. Could we then turn to Will Beer at Bevan University Health Board?
Yeah, thank you very much from Bevan for allowing us to join the session this evening. And just to reiterate really the points that Adrian made earlier, we'll continue to work closely with Powys Teaching Health Board and the practice and the local community to support everyone throughout this process and keep the lines of communication open. So thank you very much for letting us join.
Apologies, I called you Will Bevan. It's Bevan is in the Health Board, not Will Beer. So apologies, Will, for that.
I'm honoured.
Kate, do you have any further reflections from the clinical medical director's point of view, or your colleague was with us from primary care?
Thank you, Kirsty. No, I've just found this really, really helpful. I think we've had some very important questions and some very helpful comments, which will give us sort of a more helpful consideration into when we're looking at this in the round. So thank you very much to everybody that's contributed. Something else from you, Amanda?
Yeah, and just thank you for myself as well for everybody who's taken time out of their evening to engage in this process. I'm very glad to be part of this process and part of the engagement moving forward, so thank you.
Thank you. So before closing, can I just reiterate what both Hayley and Adrian have said this evening? This engagement process is currently live, and I would encourage everybody to continue to reflect, to think about the issues raised by this application and to respond to the online questionnaire. As Adrian says, if you've already done so, that does not prevent you from adding further thought and reflection. And if you have not able to, or you know that your neighbours or your friends down the road haven't, please do take the time to encourage them to have their say during this process as well. We outlined earlier that if an online form isn't your chosen method of communicating with us, our hard copies are available via telephoning or emailing or writing in the very old-fashioned way to Powys Teaching Health Board, and we can ensure that you get a hard copy. If you would like to access accessible versions of the documentation, please do let us know and we can ensure that those are available to you. And finally, can I just remind everybody of the face-to-face engagement event that is due to take place on the 14th of February. Colleagues from Powys Teaching Health Board will be available at the Gilwern hub on that day. So please do come along between the hours of 2 o'clock and 5:45 in the evening, where you can come and let us know how you feel about the application, and we can take those views on board. I will be there, and I would be very pleased to chat, more importantly to listen to your views, your suggestions, your concerns, as we take forward this piece of work. And again, as Adrian said, it will be subject to scrutiny and final decision in public by the Powys Teaching Health Board. So thank you once again to colleagues that have joined us on the call and for your interest in these really important things. We're very grateful for your engagement and your interest and your desire to be heard during this process. Diolch o galon. Thank you so much. And with that, Adrian, let's bring this evening's meeting to a close. Thank you once again.